First of all, this is now being looked at by a technical advisory group on virus evolution, so they can decide what status to give it. I want to say that in the WHO, there is absolute gratitude to scientists in South Africa for the speed with which they've characterized this virus and for their transparency and openness in telling the rest of the world about it. Of course, they're facing a backlash in South Africa because there are some locally who are saying that by talking about this, that's led to immediate actions against South Africa and other Southern African countries that feel like punishment. And so those of us in the WHO feel really, really torn about this. Yes, it's good that the world knows about the variant. Yes, it's good that the research is being done. Yes, it's good that we're answering the questions, but it is totally wrong that there is vilification of the South African scientists who've done the work. And I'd like to suggest that it's really unfortunate that the immediate reaction is to be to cancel flights and to stop people from South Africa being able to travel.
That's interesting because the South African health minister, of course, held a press conference earlier here on Sky News. We showed that. He said that this was a completely unjustified reaction from the United Kingdom. Europe also proposing to suspend flights as well. That's the advisory there from Ursula von der Leyen. Do you think that it is unjustified? Some might argue that the United Kingdom is actually learning from its past lessons when we didn't shut down flights coming in and out.
So this is tricky. Number one, most of the evidence that we've had over the years tells us that it's really difficult to keep viruses and bacteria out of countries through border restrictions. It just doesn't work. Number two, what we've also learnt is that actually what you really got to do is to work on how the virus is transmitted within your country. Right now in the UK, there is very limited official requirement for mask use, at least in England, very little official requirement for physical distancing, very little official requirement for hygiene. And yet in WHO, we know that those are the most effective ways of stopping this virus from spreading. So it seems kind of odd that on the one hand, the UK is not following the official guidance on what you do to reduce COVID spread, but on the other hand is saying we're going to move very quickly to shut our borders, when certainly from the WHO side, we have not recommended that kind of action at all.
So would you say that this is an inefficient response and not the right one, given the very basics? And to be honest, you're not the first expert I've spoken to on air over the past few weeks who is saying the United Kingdom needs to go back to the basics, hands, face, space. Would you say that this is an inefficient and potentially a response that won't work?
So I'm terribly careful not to make remarks that appear to be critical of any government, but I am perfectly prepared to encourage government action where I think it's right. All over Europe now, the correct action is that everybody should be wearing well-fitted face masks at all times, but especially indoors, and everybody should be doing everything possible to avoid breathing in air that is exhaled by other people. Everyone should be practicing really good hygiene. There should be good ventilation in confined spaces. And yes, people should get vaccinated if they're in the age group that will benefit. We've got to do all these things. This virus is just unforgiving. It is brutal, and it's coming back into Europe with a vengeance. So please, yes, could we do everything? With regard to comments about what's...
Sorry, do continue, sorry.
I just want to say that in general, with regard to decisions about flights from Southern Africa, I just want to be very clear that as soon as you start doing these kinds of restrictions or travel bans, you're also having an impact on the economy of countries. Southern African nations have been badly hit by COVID. They do not have much room to be able to provide extra support to people whose income might be reduced because of unemployment or other factors, due to decisions taken by other nations. So just everybody, when you're going ahead and introducing these kinds of unilateral travel restrictions, whether it's for people from a particular nation or for people who are not vaccinated or whatever, please think of the human consequences. Please speak to the people concerned before you introduce the things, because we're all interdependent. This pandemic is everywhere, and it's really unfortunate when countries or groups of countries act in a particular, possibly single-handed way without consulting with others.
And I assume that also applies to vaccines. I'm afraid we're going to have to leave it there, David Nabarro. I'm sure our viewers would love to hear more from you. Thanks very much.